Hello, everyone, and welcome to the Save Your Skin Foundation roundtable discussion on the future of healthcare. Just because we can doesn't always mean we should. My name is Natalie Richardson. I am a metastatic melanoma skin cancer survivor and the managing director of Save Your Skin Foundation. We are an organization dedicated to reducing skin cancers in Canada and providing compassionate support for those living with skin cancer. And we are always on the lookout for ways that can help with that mandate, but we also acknowledge we're not the experts on advanced technology. As part of Digital Health Week and the hashtag Stop Waiting and GetSkinHelp campaign, we hope this roundtable will help us understand how healthcare is changing due to new technologies and what needs to happen to keep patients safe. With that said, please allow me to introduce you to the session moderator, Dr. Jonathan Reichental. He is the founder of the advisory, investment, and education firm Human Future. He is also a multiple award-winning technology and business leader whose career has spanned both the private and public sectors. Most notably, he served as the Chief Information Officer for the City of Palo Alto in California, and in 2017 was named one of the top 100 CIOs in the world. Thank you, Dr. Reichental. Welcome. The floor is yours.
Oh, thank you so much, Natalie. I am so honored to be part of this panel today and to participate in this very important cause that you're advocating and part of. So I'm very happy to be here. I can't think of a better way to spend my time than to talk to really smart people about matters that impact every one of us. And today we're going to be talking about healthcare, but through the lens of emerging technologies in particular. So I'm really thrilled at the three people I have here, and I'd like to introduce each. We'll start with Ashley Casavan, who's with us. Ashley has been at the forefront of building tools and policy interventions to support the responsible use and adoption of innovative technologies, both with her work at the Government of Canada and now as the Executive Director of the Responsible AI Institute. She's also named as one of the top 100 most influential young people in government by Apolitical in 2018. Welcome, Ashley.
Thank you so much. Really happy to be here.
Great. Next, we have Perth Singh. Perth is a government maverick and a trailblazer who has helped the Government of Canada embrace open source technologies. He's now the Assistant Director General of the Industry Canada Innovation, Science and Economic Development Team, where he's leading the work on the development and implementation of digital credentials. Wow, that's pretty cool. Welcome, Perth. Great. Okay. Nice to have you here, Perth. No problem. And finally, we have Keith Loo. Keith Loo is the CEO and co-founder of Skinopathy, a Canadian medical technology startup that is revolutionizing the patient circle of care. He's heavily involved in the Canadian tech startup community, consults out of several incubators and accelerators in the Greater Toronto area, and is an entrepreneurship instructor at the Schulich School of Business. Welcome, Keith.
Thanks for having me.
What a great group of people. So let's jump right in. And this question is going to be first directed at you, Ashley. In the 21st century, technology innovation is reshaping every part of society. Talk about how you see technologies evolving the way we all access and receive healthcare information and services.
Thanks so much for having me again and really being part of this. The topic at hand is quite important to me as we've been experiencing some challenges within my own family, and really that's allowed me to understand how important delivering of healthcare services in a safe and efficient way is. And it's really brought a new perspective into both the opportunities, but the challenges of technology related to the delivery of services writ large, but healthcare in particular, as it's so personal to us. And so what's important to think about, and what we really advocate for with the health organizations that we work with is when thinking about the use of specifically AI technologies is what we're focused on at the moment, is thinking about then what it means to do so in a responsible way. And so that's looking at things like the potential bias associated with those systems, which we've seen a lot of work done related to thinking about the social determinants of health and how that type of research can be applied to how these systems are trained and built and managed. Also thinking about the safety and security of these systems, because we're dealing with privacy and personal information related to people's most deepest, darkest concerns and issues. And so not generally just talking about privacy. I know there's been lots of really great articles on this about how Tim Hortons is tracking all of your information. And so there's a very different spectrum, though, when talking about that from a consumer perspective, also important for privacy, but really, really important in that health sphere. And so it's things like that all really culminate into having appropriate accountability or oversight of how these systems are, as I'm saying, designed, developed, and then deployed, so that they can both be used in the most effective way possible. And as I said, I think getting more immediate care and access so that people, our loved ones, are saved in these circumstances is really beneficial. But we want to make sure that those systems are accurate and that they're not providing misinformation or sharing private information in a way that could then jeopardize us in potentially a different way from the reason why we are using that healthcare system in the first place.
Such great points. Thank you. Perth, I'd like to ask you a similar question. I mean, from where you sit and from your perspective, in what ways are new technologies shaping the delivery of healthcare?
Yeah, thanks for the question, Jonathan. I think we do talk about new technologies, and obviously they've been having an impact on kind of all economic sectors. But I think we are all aware about the whole. I think the changing landscape after COVID-19, right? Like, I mean, in the beginning, it was a whole aspect of people were afraid to go out, or they couldn't go out because of their health was at risk. And in the beginning, I think organizations, especially the ones that are more innovative, kind of like really, I think, understood what that meant and kind of took opportunity off it and used these new technologies to actually say, okay, how do we now provide healthcare or any other service within this new domain, and how do we kind of really go forward? So I think technology in general has completely, like, completely changed the way. I think in a year and a half, 2 years, I think 2 years ago, if you would have asked me, like, how fast could we move, I never would have thought that we could have moved this fast. But I think COVID-19 really accelerated that. And within healthcare, I mean, this whole notion of, like, I'm afraid to, sometimes, or people may be afraid to, go to an in-person office. They would like to get healthcare from where they are in the safety of their homes. They would like their information provided to them securely, and they would, do vice versa. So all these aspects, I think technology plays a huge, huge role, both about providing care from remote places, but also I think the way, like, but that particular model also now introduces other risks as well, right? Benefits as well, but risks as well. And sort of Ashley talked a little bit about sort of, I think, the data and how we need to be careful, or how decisions are made. We need to be careful when we use these new technologies. But yeah, like, I mean, it's amazing what 2 years has brought us, and like what we're doing now, and what companies, like especially some of the innovative companies, are using these new technologies to look at new delivery models. Not just from delivering, but also, I think, their workforce as well, right? Like, we all know, like, we're here, remotely, from different places, and the same thing, I think, with our health professionals, providing services from all over the world to individuals that are all over the world. So technology has played a huge role in this shift, and it's amazing. I think every time I look at talk to people and see the amount of changes that we've made and the things that are happening are just it's tremendous. So just a whole dramatic changes that we see, like, across all sectors.
Thanks. And I do want to come back to some items that you, Perth, and Ashley, you spoke about, but I'm keen also to hear from Keith on this question, because he's living and breathing this every day by building a business around how tech can be can accelerate and deliver better healthcare. So I'd love to know your perspective on this question, Keith.
And you bring up a good point, because both Ashley and Perth talk about, the technologies that we're seeing and huge transformation. And I think whereas maybe because we're touching the patients, right? And so what we're seeing is consumers are now, patients are expecting, what we expect are the experiences that we get from everything else, right? Like, think about, I can watch a movie wherever I want. I can do my shopping wherever I want. And the pandemic has really accelerated I want to get my care anywhere I want. And that's certainly something that we've seen as a rapid acceleration during this time. And I think the pandemic has really helped close that gap to where, healthcare is over here and me as a citizen, I'm over here, and it's kind of, there's this distance. It's really kind of closed that gap. And I think that's great in a certain extent, because I think, medicine and healthcare has traditionally been a little behind in the other sectors when it comes to innovation, and with very good reason, right? You want to make sure that when you drive innovation, that you're doing it securely and safely and compliantly. At the same time, maybe because we relied too much on that, we're so behind. And so this allows us to get caught up, which is great. But of course, like everyone said so far, it's opened up a whole slew of other challenges that we all have to tackle together. And I think actually all of us in this conversation are probably quite interested in. Mm-hmm. But it's quite exciting. I mean, if you think about, some of the things that even we're doing, but we're seeing elsewhere too, now we can screen for skin cancer on your phone. I mean, just think about that. Saying that 2, 3, 5 years ago, I wouldn't even consider it, right? I want to see my doctor to make sure that this is checked accurately. But now when you're telling me, oh, wow, it's just as accurate, and it's, if anything, it can help the doctor in assessing me and treating me, I think that's phenomenal, right? So yeah, I think technology is really driving, really advancing, and it's exciting.
It's interesting as I listen to you, it's such a great point about, how we think about consumer technology, and then we think about the healthcare system. We definitely see them as very distinct items, but what you're saying is in a way they're converging, and we want more of a consumer experience. We want some of those devices that we have in our lives to be how we are receiving information and services. Do you think there's like an education is required? How do we bring people on this journey to use their day-to-day tech for doing these important things?
There's so much education that needs to be done. I'll give you a very good example that we see every day, 800 times a day. In Canada, there are wait times when you have to, get referred to someone, right? Let's say you get referred to a dermatologist or a plastic surgeon to help you with your skin challenge. That wait can be months. And unfortunately, during the pandemic, we've seen it go as long as 18 months. And that's a long time. And so, of course, part of what we do is try to, make healthcare accessible to all Canadians. And so we shorten it to as quickly as possible. And the fastest we were able to help someone with skin cancer was 4 hours. We saw them online, saw that it was cancer. We need to remove this, brought them in, took out the cancer. But that's not every case. We knew this is really urgent, right? In some cases, we had a patient that had to wait 1 month. And in her view, that was way too long. And, a lot of complaints, 1-star reviews on Google. I totally get it. I don't want to wait that long if I have a health issue. However, I think what people don't realize is that's probably in the top 5% of, speed already. Is there room to improve? Absolutely. We would love to make sure everyone gets doctor attention today, but we are working towards that together, right? And so I think about education there is probably very helpful, and that's just one example. I'm sure Perth and Ashley have much more.
Yeah, maybe if I can just add to this, I think that the work that Keith's doing and what he's talking about is super, super important. The pandemic definitely expedited our desire to have these systems operate a lot quicker and have them across all of these dimensions. And this whole, that's created, I think, that cultural challenge that Keith's talking about. Like, just because we get our Amazon package on demand does not mean that then we're going to get our healthcare results also on demand. And I think that one of the things, it is great to get these screens done in a more expeditious way. However, again, going back to kind of my personal recent experiences on this, fortunate or unfortunate, it's allowed me to see, though, that you do kind of want that time. Of course, the worst part is when you don't know, and it's awful, but you want that to be accurate. And I think one of the challenges that's been documented, and not necessarily with Keith's system, so no offense to Keith, but accuracy in these skin cancer detection systems, because they haven't been trained on all populations with different types of skin color, is leading to a lack of accuracy in some demographics over others. And so even then, having adoption just for populations where there's been appropriate training data for that to make them accurate is problematic. And so we really need to even understand, I think education is important, but also understand things like equity and availability and access to who. Is it just people that can pay for it? Is it just people that have certain types of skin tones, that have a well-known issue or not? And so these are all things that, again, just putting my recent lens on this, especially, I would rather wait than not know at all, or not know the wrong thing, and then something else happens, and then you lose confidence in the system, both the healthcare system, but then the tooling itself, which can lead to then compromises in general adoption.
If I can just add on to what you're saying, Ashley, I agree 100%, because you don't want to get a quick but wrong answer, right? And so, and the one thing that because our company is a lot of doctors, and the way that we do it is you do the technical screening with artificial intelligence, then we do a clinical screening, so a doctor actually confirms it. And then after, we follow the patient through and do a pathological screening as well to confirm. So now, right, and so if we do a really quick, hey, this is what you have, but this is not verified. Let me get the doctor to verify for you first, right? But at least it gives you an indication, but it could be wrong. Yeah. But after you get a clinical review as well, you should be pretty confident, hey, this is probably urgent or not.
Yeah, and sorry, Perth, I will let you talk.
Yeah, go ahead, just go ahead.
What's super interesting about this, so amazing accountability. This is a best practice for anybody that's listening. But I do, my mom she's retired now, a pathology clinician, and she was, we talk a lot about the pathology process now that our worlds have like finally met, and we understand each other. And it was super interesting to understand, what does the lab go through when they're processing this? And there's inaccuracy in the process between the pathologist technician cutting the wax. And anyway, Sarah, I'm clearly still terrible at this, but depending on the thickness of it, you could get a different result. And so this is what Keith's talking about, is augmenting those human processes not only expedites it, but it does increase that accuracy. But all of those working together takes a much better account of those demographic challenges and accuracy challenges I was talking about before. Sorry, Perth.
Yeah, that's fine. And just jumping into this, because I think the question was about education. And, one of the things I always find is that, like, the healthcare system is such diverse, right? Like, there's a lot of different professionals that have to come in, and there's a lot of things that are going back and forth. I think there's this whole notion in the fact that, some companies want to use technology, and, obviously, like, skinopathy is kind of at the leading edge of that. But, you're also kind of reliant on other providers to provide that information, right? Yeah. So how do you get that? How do you get the right information, the right people, so that, we can do diagnosis correctly, we can, prescribe things correctly, and how can that kind of go in the value chain? So I think this notion of using technology by consumers, like, not only just like, taking sort of like, I would say, like pictures of yourself, but also having your access to your own records, right? And being able to provide that to the right individual so that they can actually help you and support you is also really important. So I think there's an education that has to be done there as well, because if data is locked in about individuals in some spot where it takes you 4 months to get it or 2 months to get it, or you're faxing it across, sort of, I don't know, all the ways of, putting your information at risk. And that's going to avoid people from having to go through these sort of more innovative ways of getting healthcare. So I think that consumer also needs to, I think, also understand the fact that there are new ways to having your data, having control of it, and sharing it with the right health professionals as well.
Mm-hmm. What I hear, one of the things that emerges to me from this conversation so far is, is a question of risk, right? And it's intuitive that consumer apps, there's a much larger tolerance for risk, but when it comes to things like detecting a disease or illness, we don't want to know that there's a high probability it could be a wrong diagnosis. We don't want those to be significant risks. Maybe I start with you, Perth, just to continue, with you, because your work today includes, science and innovation in a broader way. How do you think about risk in different domains in the work you do? And maybe if you had a thought about healthcare, how should we think about innovation in healthcare?
Yeah, so I'll be honest, looking at and I'll give you sort of personal example because
Yeah.
went to Sandbanks this summer and spent way too long in the sun, and as my team is talking about skinopathy, there's a little mark I have and I keep thinking about it. I gotta go to the doctor. And then I was on the website. I'm like, okay, I should download this app and actually check this little mark here. What is it about, kind of thing. So I think there's a couple of things. One thing is that we're always searching for information. We're always trying to look at it. It could be as simple as me going to some Google and kind of putting picture and kind of have a picture of what does this look like? What does this thing look like? So I people are going to do that, and I think the more tools you can give them to kind of inform themselves or find out more information, it's always better than not having that those particular tools. So I just got to say there, Keith, I thought I was just looking at your app and I was honestly really looking at whether I should sort of really look it over and just look at that little skin mark that I have. So I think providing tools is good. In terms of risk, and we're kind of at ISET particularly very much focused on this digital credentials aspect. I can tell you that because one of the big things is always about people providing information or getting information, right? And so how comfortable are you, and what happens to your information? What does somebody else do with it? Is it at risk, and all those kind of things. I think those are really, really crucial components, and we need to sort of look at how can you ensure that information is trusted, that information is secure, that information is controlled by the individual whose it is, right? And they can share it with whomever that they want. So I think yes, risk is there, but you gotta technology can come in and I think play a better role of ensuring that information is protected. And the other thing I just wanted to say, because I think it's something that we're actually dealing with with one of our partners, is this whole this aspect of, and I'm not sure this is the correct word to use, right? Having sort of accreditation, right? These professionals, what is their qualifications? Are they really accredited to actually provide the service to me? And when I'm talking with somebody, so I want to know that. So how do I know that? Is this individual, who now could be anywhere in the world, right? Is this individual really has the sort of the right qualifications to provide services to me? So that's an element of risk, right? How do I ensure that for my information? Not only am I giving information, I'm trusting somebody to provide me some kind of healthcare, and then they're giving me that information. So how do we protect that information? How do we protect the fact that there is trust built in our current sort of societies, where we kind of go forward and say, hey, somebody has to have this amount of education in order to provide this particular service. So I think those are not necessarily insurmountable risks, but we need to, I think, address them head on, and really kind of, and I think technology can provide the solution in sort of some of these cases, right?
Yeah. And I need to, it's interesting because we've got Keith here. I want to ask him that very question. When people are learning about your company, to what degree are they asking, is it run by doctors? Is it created by doctors? What doctors do you have working for you? Tell us about that to Pert's very point.
And that's exactly it, right? Look, even if you were just to go on your app store and look for skin cancer screening, I think when we first did our let's say research into whether or not we should even go after this, there's something 300 and something apps online that do this, right? it's not novel in the sense of, hey, take a picture and tell me what it is. I mean, we've been doing this for years for just about everything, right? And so there's plenty of things that are out there, but I think actually you can appreciate this, especially from a responsible AI perspective. We don't necessarily know what they're doing with this information. We don't know the process that are happening behind this. We don't know if it's doctors or if it's like a, data skimming type of company, right? We don't know. And, after we did our research, we found a few very good technology providers out there that do amazing things. But at the same time, we didn't find anything that really allowed us to not just provide the screening, but also connect you to the doctor and then, take you through the entire journey that you have to deal with as a patient. And so, but to that point, so we needed to do this even to think about how we consider our technologies, but we get this every single day, right? The very simple one is, hey, I have to provide you with my OHIP card. Why do I need to provide you with my OHIP card? Like when someone asks you to do that online, alarm bells start ringing, right? Just like this is even more sacred than asking for your credit card. And so, it's the education process of, look, this is actually for the doctor. These are doctors that are going to see you. They need to know that you are indeed who you are, right? And this is literally a part of that process that you would normally do when you go to a doctor's clinic, except now we're taking it online and taking it one step further. But there's so much education that we have to do. But unfortunately, we're a startup. We're 15 months old. There's only so much education we can afford to go and create. And so it's really, working with organizations like Save Your Skin, but, partnering with ISED, it's these things that actually help us drive the credibility. And, we really appreciate and respect the credentialing system that ISED is building, because that way they can actually verify for us that this is indeed Keith from Ontario. This person should see this doctor from Ontario, and then vice versa. We can actually go use the system and say, hey, this doctor's licensed in Ontario. And, that's how you can make that match, and everyone should be confident. But education, to your point, is pretty much every day of our lives, it feels like.
If I can just add, so I think that credentials are really, really fundamental to the exchange of information online, no matter what. When I worked for the Government of Canada, always were involved in these conversations because it affects every single line of business. But as I spoke about earlier, the healthcare being so near and dear to us is, as Keith was saying, something that we want to verify even more. And being really clear on who needs access to what information, I think is really fundamental to that. But I do want to talk about another aspect of trust that Perth was talking about before, in having the verification of not just like you are who you say you are, which is what those digital credentials are, or this person is qualified to do this, but what are those qualifications that constitutes that? And I think this was a lot of the challenge that has existed with any sort of online services previously, is that we don't have that trust. And as was mentioned early in my introduction, my background was developing the directive on automated decision-making systems for the Government of Canada. And in that was because the government was really starting to work with people like Keith, leverage these different types of systems and services, and think about how to use automated decision-making systems. And in that capacity, there was a survey that was done in 2018 by Ipsos. And one of the headlines from it that really reminds me of what you were just saying, Keith, was the more that it matters, the less it's trusted, or the least it's trusted. Yeah. And so, or the least trust people have. Anyway, programmer, sorry, but the Ipsos is much better than that. But the point is that these things that are, as I said, kind of more important to us, the more concern we have. And that's why then leaving that work, I took a leave of absence from the directive. It was from that, actually, but my work there, to really expand on what we were trying to do with the directive in thinking about how to apply that trustworthiness to mitigate those risks or any of these unwanted challenges that can occur in these systems. And when I said, Keith, that was the best practice, that's actually really what we're trying to establish within the Responsible AI Institute, is a private governance version of that public governance. So a certification program at the AI system level. That has dependencies on what Perth was talking about at the individual level. Thou shalt have these certain types of competencies. They should be a doctor to demonstrate these types of protocols. But it's these other things I was talking about in my introduction as well, ensuring that there's trust in a system so that the safety is tested, that the robustness of the system is tested, that there's explainability in it, etc. And so all of those different types of things are what our organization is working on to set a standard framework around and then provide a certification program so that similar to that credentialing, Perth, if wanting to use that, knows, okay, there's 300 different options. These ones that claim to be doing the same thing, this one has a certification. That means it's gone through this third-party accredited process.
Good. Thank you for great comments there. So this question's for you, Perth. The good news story here overriding all of this is that we are seeing an uptick in innovation in healthcare, and ultimately that benefits all of us. We're conservative and responsible, I hope, most of the time in how we do it, and the government plays a significant role in regulating and ensuring that we don't just haphazardly deploy medicine or tools, right? But at the same time, government potentially can be slowing things down. And sort of in the 21st century, how should we think about the role of government, both to regulate and ensure good outcomes, but also not slow down the innovation we so much want?
It's a big question there, Jonathan. It's as we all know in Canada, like we're in this federated model, right? Like with obviously like different responsibilities from a federal, provincial, territorial perspective. But I mean, I think innovation like has a lot of commonalities across all sectors, right? How do you promote innovation, and what are the things that we do? I know that there was a little bit of conversation about like what the open banking folks have been trying to do, right? Like how do you get these these fintech companies that are coming in, and how do you kind of like get them to innovate and kind of get that control over from these large banks that have potentially like stopping innovation, right? And perhaps there's an element of that here as well. So I think one of the things that I kind of already mentioned, I'm going to like repeat it again. I think this issue of enabling like trusted sharing of data like is, I think, key. Like, again, the same conversations with like open banking or things like that I think also apply to healthcare as well. How do you get the startups to easily get that information? It's going to take you 5 months to get your information from your health provider. Like, it's going to really limit the choices that you have, right? So I think that's really, really key. I think the government can definitely play like and even I was really Ashley has just kind of enlightened me today with her conversation about certifying AI, like another kind of aspect, like these standards that get into effect, and then you can like assess against them and ensure that yes, this is responsible AI, it is meeting those standards. So I think that's one aspect of it, whether that is like setting the infrastructure or enabling standards or enabling these certification sort of like programs to exist so that trust can kind of like really build, right? I think that's one big thing. And I think obviously there's the other things that government always does, which is like support like our innovative companies, our smaller companies. I think that they can continue to do. I was just reading this report which came through our public sector service delivery council, and it talked about the amazing amount of collaboration that happened because of COVID-19 and this research that got shared across the world, right? So again, I think like that's important for countries and jurisdictions and everybody to come together to say, okay, let's share this information that can help us actually achieve a common goal, which is this pandemic, this global threat that we have, and that obviously has benefits to everybody. So I think that's another element. So those are two big things I would say, like enable trust with sharing of data, and then really enable collaboration across many different sort of organizations that are working on healthcare.
Great answers, great suggestions there. And so Keith, you're at the front line of this. You are sort of the epitome, the innovation startup trying to think differently. How can government support you?
It's interesting. I think the government, even I've noticed this in the past year, probably a year ago, was complaining about the lack of government support for organizations like us. Right? a year ago, we were 2 people, 3 people trying to build technology to help Canadians. And, it took a bit of time and effort to get the attention of different government organizations to support us. And absolutely get it. Everybody's building something. Who do you go and support? There's only so many resources. And I think traditionally, I think the government was more focused on supporting more established organizations. Think about your multi-million-dollar organizations who may or may not drive innovation as quickly as, say, a small startup. But again, for good reason. I think what we are seeing is a bigger support and push for startups and small organizations. And I think continually accelerating that's really important. I mean, ISED is an organization that we have partnered with under Digital Trust or Credentials platform. But you were seeing this also with the National Research Council, right? And so they've, look, we're a small company and they're choosing to work with us. That helps drive innovation. I would say, if anything, maybe removes some more red tape sometimes, or a lot of things that companies like us can benefit from. Unfortunately, it's typically reserved for much larger organizations. That would probably be the only thing that I can think of.
That's a great answer. I'm going to get to our last question here, and I'm going to work backwards from Keith, Perth, and then I'll give you, Ashley, the last word on this. And we can't talk really about healthcare or innovation if we don't talk about COVID. So I want to just get your personal opinions in what you believe COVID-19 has done to alter the course of how we think about healthcare technology, community expectations, and healthcare delivery. So I'll start with you, Keith.
Well, COVID has really accelerated deployment and development and innovation of things that we need now. And, there are things that we've needed a long time ago, but we didn't have that urgent push. It took a once-in-a-lifetime pandemic to really make that happen. But, if you're talking about, I'm thinking just at my doctor's visits 3 years ago, I have to drive an hour and a half to go see my specialist, and I probably have to wait 2 hours in the waiting room, all for them to say, everything's okay, right? That could be half of my day gone. And so, so thinking about even virtual or even phone consultations for things that can be done, it's actually made it legit, if that's the right word I'm trying to find, right? It's okay, it's acceptable, it's the right way to do it. And I think so it's accelerated a lot of advancement and evolution, and opened some regulations. And I think we want to continue driving that.
I love that example, and I echo you 100 times. I sort of thought about distance healthcare occasionally, but now it's the way I do it, and it works really well. So thanks for that. Perth, your thoughts briefly.
Yeah. Just briefly, I think people's minds have opened up, like to these innovations, right? Like, before it was like, what is this digital thing? I don't get it. Like now it's like, oh my God, this is actually going to help me, right? Like, and I say it again, like, this marriage of AI and your phone, and like looking at whether you have skin like some kind of skin disease or not. Like this is like incredible, right? And there's a lot of people who would choose that because it's of benefit, and for some people like me who would probably be wondering about this for weeks and weeks and wouldn't go to the doctor anyways, hey, this is also beneficial as well. So I think people's minds have opened up. I think that's key that COVID-19 has done. Like, not only is it driving innovation from the the companies that are providing the services, but I think individuals are more open to actually using these technologies. So I think that's a key part.
Yeah, and finally, Ashley, how do you think about this, and has it impacted your organization and the way you think about this issue within your organization?
Definitely. I think it's brought, as everybody has been saying, these issues more in the forefront. And we've been having a lot more conversations about our relationship with technology. And so there's that comfort level, but there's also then, I think, a greater understanding of what some of those, the right questions, I guess, to ask are. And so whereas a few years ago, even within the government context, there was also questions around, well, why do we need this directive? Why do we need these types of rules? It's too much, Treasury Board, go away. It's really an understanding of how having some sort of guardrails around these systems like Keith's example, there's 300 of the same thing. How do you know which ones to trust and which ones to use both as a consumer, but also as a service provider, like the government is? So I think that all of this is really important, and just it's really nice to also have that infrastructure now and be past to those conversations. Back to what Perth mentioned early on.
Fabulous ending there. I'm so grateful for you guys. You each represent really important parts of our economy, and you all have a lot of important things to say and about healthcare and the future of healthcare, which it's a very personal topic. It matters to every one of us. So I want to say to you, Keith, thank you so much. Perth, thank you so much for your comments and wisdom. And thank you for everything you do, Ashley. It's a real pleasure to know you and to hear from you as well. Thank you again. And now we'll hand you back to Natalie. Welcome back, Natalie.
Thank you very much. Thank you so much, Dr. Reichental, Ashley, Perth, Keith. This has been an incredibly informative and interesting panel. I appreciate your doing this to give us this great, wonderful information. As a patient in the system already, but also as a member of the public with family and friends who may very well need this type of support and technology, I'm grateful for the care and dedication that you and your organizations are putting into your work in this space, and the security and the safety that you're clearly very adept at handling. So thank you very much for that. To close out the roundtable, I would like to remind everyone to jump on the hashtag #StopWaiting hashtag and raise awareness about skin cancer and other skin diseases. The new GetSkinHelp app makes it very easy and is even covered by your Canadian health card. We'll put the download links in the description below. On behalf of Save Your Skin Foundation, our team and our community, I'd like to thank you for watching. We all look forward to seeing this initiative allow Canadians to get skin help.